This is a case of a 75-year-old woman who was referred to us for 3D mammography. And we can see initially that on the MLO image there are a few calcifications that look fairly benign. In the CC projection, again we can see the calcifications and we can see the normal fibroglandular tissue of the breast. But in the lateral portion of the breast, there are some regions which look suspect for possible architectural distortion. So we can further evaluate those with the tomosynthesis images. And we can see that when we get to the upper outer quadrant of the right breast, that there is a spiculated mass evident with surrounding architectural distortion, which is a lot better seen on the tomosynthesis compared with the C-view image. That region corresponds to this area here on the MLO view. So again, we'll go to the tomosynthesis. This time we're starting from L for lateral, scrolling medially. And when we get to that region, we can see that there is, again, a spiculated mass with some surrounding distortion evident. There was some calcifications seen in this region, particularly on the CC view, and these were further evaluated with conventional 2D coned magnification views. So I can bring them up for comparison and compare them with our original C-view and tomosynthesis images. And the image on the right here is the 2D coned magnification view. And we can see that there is the impression of a density and possibly some surrounding distortion, but it's quite obscured by the surrounding fibroglandular tissue, the normal tissue of the breast. Whereas if we were to look again at our C-view image in that area, and certainly on the tomosynthesis image, again scrolling to when it comes into focus, we can see that it is much better appreciated, a spiculated mass with surrounding distortion, as opposed to the 2D image. Even with the extra compression and the magnification, the tomosynthesis image shows it much better, even as a contact image. The patient's referrer was a breast surgeon, and before proceeding to biopsy, he actually asked if I could compare with the previous mammograms that she had had at BreastScreen, which were cleared a year ago. I had a look at those mammograms, and there was the suggestion of a subtle density in this region seen on those previous mammograms, but with the surrounding normal fibroglandular tissue, it was cleared, and it certainly wasn't obvious on those images at all. It looked like the density had significantly progressed, even when you compare with the 2D views that we obtained. But certainly with the tomosynthesis, it increased our level of confidence in diagnosing a suspicious lesion quite a bit.